Hello and welcome to Covell Conversations. My name is Krista. I'm an occupational therapist and I own a mobile outpatient practice in Colorado. I have often referred to Covell Care and Rehab as the Island of Misfit Toys. And if you are familiar with the movie Rudolph the Red-Nosed Reindeer, the classic, then you probably have some sort of recollection or memory of the Island of Misfit Toys, which is where all the toys go that don't really belong, such as a train with square wheels or a polka dotted elephant. I personally like both of those things. And I often, as an occupational therapist, working in the mainstream medical models that I have worked in, which includes home care, inpatient hospital settings like acute care, rehab, skilled nursing, outpatient, traditional outpatient, and also mental health services in the hospital setting, I often felt like I didn't fit in. And I think that's normal, kind of human nature. But as an OT, I was always looking to develop new programs, or I wanted to paint the gym, or I would get a wild idea of something new we could do. And so I was just always veering off of like the mainstream expectations of an staff therapist. And it was great though. It was a creative outlet for me. It was supportive to the patients that we served. And then in the long run, it ended up bringing me to be at Covell Care and Rehab, where I feel like I can be very creative, and we've created a business that truly is not like anything that you see in mainstream healthcare, yet we can still bill insurance. We work with physicians. It's been a labor of love, but also kind of a practice that doesn't fit in the mainstream medical model, hence the Island of Misfit Toys. That also, and this comes from a place of love, speaks about a lot of our patients. These are patients that maybe they don't qualify for home care, but they still have needs that require skilled occupational, physical, or speech therapy. They might have diagnoses that you don't necessarily go into an outpatient clinic and get treatment for, such as Alzheimer's disease. You're not going to bring somebody with Alzheimer's disease into an occupational therapy clinic and work on bathing and then send them home with their loved ones. That's not going to be impactful at all. Or mental health disorders like complex PTSD or bipolar 2. You might have a therapist, a counselor, a psychiatrist, but it's so important to have an occupational therapist. Post-concussion. And these are the patients that often fall through the cracks. And when they fall through the cracks, the nice thing is that we try to have a little island down there in that crack, which is the Island of Misfit Toys for us as therapists and for the patients that we serve.